glad to have you with us for the entire program.
Yeah, I'm looking forward to it. Looking forward to hearing John, for sure.
Yeah, it's, anxious to bring him on here. Friend, very dear friend of the Institute, been with us from day one. He's one of our he's one of the industry's premier thought leaders in the market. He's our co-chair of our events and member of our advisory board. John Young, CEO of Consumerdriven. Good morning, my friend.
Good morning, Doug. Hi, Amy. Hi, Jonathan.
Good morning.
Good to have you with us this morning, John. I know we're going to talk about how marketplace noise may be the best thing to happen in consumer-directed healthcare, and I'm anxious to get your thoughts around that. I think you have a very interesting perspective, as always. But I want you to talk to our audience a little bit about, for the first time, John Young missed a forum, an expo.
We missed you, John. I'm usually the one in the crowd. I'm the one in the crowd going, amen, yes, I believe, because you always have such great insight. So looking forward to hearing you today.
But he had a really unique opportunity to travel to Singapore and keynote at the Asia HealthCare Summit. And John, talk to us about what Asia is doing about healthcare and kind of what you told him about what we're doing over here.
Oh, gosh. Asia has a variety of approaches. It's an enormous market, right? And some are providing everything without requiring any kind of cost sharing. It's like a free healthcare for all program. There's such a program in the Maldives. And some provide individual products to supplement government programs, and there's some that are toying around with these types of spending accounts. And a few are frankly just figuring it out, where there's still a ton of barter. Where here's a chicken, please fix my arm, kind of healthcare. I mean, there's quite a bit of that in some Asian countries, especially in the outlying regions, and they want to learn how to avoid the mistakes we've made. So I started my presentation and I said, thank you for inviting me from America, and I want you to know that America is number one. I said we're number one of the top 20 affluent countries in infant mortality, injury, and homicide rates, teen pregnancy, sexually transmitted disease, AIDS, drug abuse, obesity, diabetes, heart disease, lung disease, disabilities, and not surprising, gun-related deaths. And then I got their attention to say, this is how we're trying to solve for our problems. And I told them how consumerism and marketplaces are the best ways to encourage engagement and get people healthier and lower costs. That old chestnut.
Yeah. Interesting stuff. And this included wellness too, right? The whole, all of it, right? From not only plan design, spending accounts to wellness, et cetera.
Absolutely, and really trying to learn from one another how they were organizing around the delivery of care and and how people pay for it.
I think we here need to reach out and pay attention sometimes a little bit better to the global marketplace. I know there's things that are unique to, we here in America around our healthcare system, but I think we can learn, don't you, from what's going on or what's being considered globally.
Absolutely, and they can learn from us. I mean, I told them if you provide coverage up front without any kind of responsibility or incentive for people to be careful, it's going to be an unsustainable system for you, and it's much better to provide the first $2,000 of care not covered by a government program, and create these types of spending accounts to help people.
Good stuff, John. Well, let's bring it back here and talk about this marketplace noise and, why this may be the best thing to happen to consumer-driven healthcare. So what do you mean by, first of all, John, by marketplace noise?
Well, Doug, let me first say what excites me, and then I'll talk about the noise. I'm absolutely thrilled that consumerism has hit that bona fide tipping point. It's the number one strategy used by employers to get employees positioned to drive more influence in how healthcare is priced and delivered, and exchanges take that step further, helping employees customize their own coverage for themselves and their families. But there is marketplace noise out there that is chipping away at both of these fabulous movements. And I think there's three areas of noise. There's noise in plan designs, and there's a lot of plan designs being done in the name of consumerism that are not consumer-driven healthcare. There's noise drowning out the value proposition of private exchanges. And the last noise is a noise I wish was louder, and that's the noise from all the innovations hitching their wagons to the rising star of consumer-driven healthcare, like Amy's company. We need a lot more noise there because plan design, although foundational and super important, isn't enough. We have to find other ways to help engage people to be stronger at lifting this opportunity.
So tell us a little bit more about the plan design noise. So what really concerns you about that?
Well, consumer-driven healthcare in its purest form, it gave people the opportunity to win. You know, financial incentives are incentives. There was a carrot, there was a stick, and the carrot was giving people enough money in the HRA or the HSA that could be rolled over, that they had an opportunity to win. And it's shifting today where too much cost share in plan designs means a potential avoidance of care. And that really concerns me. Today there isn't enough money in the funds. And today there's too many designs where the employer does not fund the HRA or the HSA or fund it appropriately. In fact, the Touchstone survey that just came out from PwC says that 69% of employers out there contribute less than $750 to an HSA for an individual. 76% of employers contribute less than $750 to the HRA. And this disturbs me because if you would have told me these numbers in 2000, 2001 when it all started, I would have been, yeah, okay. But today, it's just not enough cowbell. And people are paying more for less coverage. So to them, it's like a rapid takeaway. And cost shifting is happening within these plans. And funds and plan design haven't kept pace with trend. And so the risk of future noise from these bad plan designs will come from employees. You know, they've seen their potential wages go to health plans, increase premiums, increase cost share, and instead of trying to change the game and saying, you can win, we casually say, you know, we got these accounts that can be used to help pay for your expenses, but you know, you have a big chunk of responsibility up front, and it's no wonder what we are hearing and hearing this concern from employees. You know, according to Allegis' excellent new consumerism index survey, consumers today are largely disengaged and not prepared to manage these new financial responsibilities. So the more we don't make these consumer-driven plan designs richer and with true opportunities to win, the more noise we're going to get from the field we are trying to liberate. And that concerns me. We need more cowbell. We need richer designs out there.
Is the noise that's going to make the change happen going to come from the consumers, the employee, and the consumer?
No, the noise that's going to the noise has to come from the advisor and the noise of bad plan designs needs to be overcome by advisors and employers that are willing to make richer consumerism plan designs so that people actually embrace this, feel that they can win, and become more engaged. That's where it is. And it takes the entire industry to support that movement. So health plans need to, you know, really get better. Some plans do a great job at pricing these things. Others are still kind of still struggling with knowing how to price a consumer-driven healthcare plan. But the whole behavior shift that occurs and makes this work is when the best practices of plan design apply, where there's enough money in the fund against a high enough deductible, so there's those two incentives, that carrot and that stick. And there's too much stick in a lot of designs, especially for smaller employers. And maybe that's because they're telling their broker or their health plans that's all I can afford, but we have to find a way. We have to find a way to build richer designs, because that's what's going to drive better consumerism.
Do you feel that, John, your perspective, and do you feel that the pendulum is going to change. I mean, it would appear that the first step is what you're talking about. I mean, employers and their advisors that maybe aren't as well educated and understanding of what the end is have put more of this cost shifting in place as the first step. Not a good first step, but the first step. But that the progression and the maturity is going to lead to where you're saying it should end up.
Help me understand that question again, Doug. The progression of is going to end where?
If I'm a broker and advisor and employer, I don't want to get stuck here too much, but if I'm a broker and advisor and I'm an employer, I've made the first step to a high deductible plan. I put what I thought was a fair amount in the HSA, but I really haven't done what is necessary to do. But I took that first step. So, as we see HealthCare Consumerism, Consumer-Driven Healthcare, moving into more full adoption, is the natural progression through this noise and through this going to be to, put more, develop a better plan design, put more, funds in the HSA, do a better job of engagement and education.
Sure. In the beginning, I think when this gets propped up, it should be a very clear message that these funds will grow, the deductible will grow, the out-of-pocket will grow. We have to make these plans consistent with trend, and otherwise we fall prey to the leveraging, where a disproportionate amount of the cost, either on the insurer or on the self-funded employer, is going to be borne by the insurer or the employer because they haven't migrated plan design by trend. And this was a soapbox I had years ago that we should increase HRAs and HSAs every year by trend. So if trend is 10% and you're giving people $1,000 into an HRA, the next year it should be $1,100. The deductible should also raise, but we haven't been doing that. And again, without enough carrot, without enough opportunities for winning, people they'll see this as a kind of a takeaway, but they gave me some sort of account that kind of helps me pay for this, and that's not consumerism.
Yep. Right, and also just educating the end user, educating the employee or the end user on how the plan works is so important. I think there are still a lot of people out there that feel like, okay, if they have an HSA, they don't realize it has to be funded before they can actually use that money. So much of it has to do with education.
Yeah.
Right.
John,
right.
John, so we've talked about plan design noise and kind of running parallel and equal is the private exchange noise, and talk about that and where you see this coming from.
Well, first, no one can agree what a private exchange, what makes a private exchange. So naturally, there's a ton of marketplace noise, which is confusing the buyers, the employers, and to be clear, I believe an exchange combines benefit administration and technology with consumerism, and it's a lift in value for the benefit administration part, and it gives more cowbell, more power to the consumerism strategy. And employers are already providing some form of a marketplace anyway. It's the only place where they're asking employees to contribute, to share in the cost of something. So they've already propped up kind of a level of a marketplace, whether it's one plan or a couple plans. They've already asked employees to share in the cost of whatever benefit options they provide. And exchanges started out as a product, a brand. The big four all had different ways of doing it, and the appetite was measurable. The differentiation was clear. And, the opportunity from each was and is phenomenal. But today you have so many options for an exchange partner and so many flavors and many vendors, all of them doing great things. Don't get me wrong. It's great that we have a lot of people in this space. But it has caused some noise. There's one of the things that causes this noise is that they're just sold wrong. I think employers get tired of a shiny toy presentation of the customer experience, and I think employers today need a straightforward message on how an exchange is going to deliver more value at lower costs and improve health. And employers are part of that noise too, because they need to first answer the question if they trust their employees to make the right decisions if given the chance, because that's what a private exchange will solve. And the exchanges need to answer the question how their approach is better than what the employer could do on their own. Now, exchanges are employer-sponsored, but it has to be clear how they can improve the regular self-management strategy that employer has.
Sure, and I do think that improving the satisfaction of the end user or the employee is something that comes as part of a private exchange, and giving them the opportunity to select, not just saying you have two plans, because everybody's lifestyle is different. When looking at private exchanges, I always like to give the example of a car. You know, if you have somebody that's 26 years old, their need for a car is probably different than somebody that is 38 with 4 kids. Well, the same applies to people's needs for healthcare too. So I think it's great, but that you're going into detail about the private exchanges and the noise. But you say noise is a good thing. Again, tell me more.
Yeah, I will in just a second, but I like your car metaphor. I've been noodling a new one too. It's kind of the difference of how we ordered cocktails in the 70s and how we do today. I mean, you had your gin and tonics, vodka tonics, Tom Collins. You had you had these standard drinks. Everyone made them the same way at every bar. And now today, it's mixology. It's everything is all, there's custom cocktails going on, and that's what's happening in the benefit business in a way. Sorry to bring alcohol into it, but what do you expect? So
I think I like your analogy better, John. I might have to use that if it's okay.
It's all right. So why is noise a good thing? Okay, so this is America, and the reward for trailblazing with true innovation like consumerism or private exchanges is often, that reward is often a trail of businesses following closely behind, seeking to profit from it, copying what you're doing, and this creates the noise. And obviously, for a competitor, sometimes they think that's bad. Does it, and they may fear that it dilutes the opportunity for that innovator. So I ask you a question, Doug. Did Luminos dilute Definity's consumerism innovation, or did it improve it?
I think it improved. I think it improved.
Absolutely, it raised the bar for both. So I think there's probably about, I'm going to say about 8 things I think that noise does. And first, it wakes us up. It's like an alarm clock. And the alarm buzzing is the danger of dampening the vision. Bad plan designs will kill consumerism. And I think consumerism is not HDHP or HSA qualified. You won't get the results of improved health and behavior change from prudence with what I'm calling care avoidance plans. Let's call it what it really is. Do you have a consumer-driven plan, or do you have a care avoidance plan? There is a difference. And the smart people out there are going to wake up to this noise, to the opportunity to keep that momentum going for the right designs where people can win. The second noise that I think is good is that noise leads to innovation. It forces us to be more creative, take chances, trying something new. There's no chance, in our business to rest on our laurels when you have competition. You got to keep innovating, and there's lots of innovation in the last few years improving the support system available to help people navigate healthcare. A lot of the stakeholders are finding new ways to engage and empower consumers to do this right. I think noise also leads to better salesmanship. And I think the successful exchanges get this. They know how to position it to be able to tell that C-suite, this is how we're going to lower healthcare costs, this is how we're going to improve value, this is how we're going to overall really save you and the individuals you employ money. I think noise leads to fast following, like DataPath. They have their wonderful patented claims vault, and they had that for years. But soon enough, other technologies had some form of an electronic file cabinet to store HSA-eligible claims. So when you're in a busy industry, they're watching each other. Exchanges watch each other. HSA custodians and technology companies watch each other. I think there's noise. Another reason why noise is a good thing is that noise from competitors, I think, makes you compete for customers. And that will end up giving a better customer experience, which is exactly what we need. And there's such a literacy problem out there. Oh, my gosh, if we solve the customer experience and using and accessing care, we can really help them move the market. It makes us more customer-focused. Noise also shows us what works and what doesn't. And best practices come from this. We learn by watching others in our space succeed or fail. We learn from seeing what ideas and innovations make a dent. And the best practices can make a difference. Noise makes life more entertaining. I think the great thing about having rivals and challenges in life is that it makes life more entertaining. It forces us, to grow and to try to achieve great things. And I think noise creates opportunities for companies to help others find the right cadence or tune or meter. So it's really noisy, let's say, in the exchange space. So naturally, someone can rise up to help employers choose that right exchange, to kind of weed through all the shiny toy presentations to understand what the value is from each, like our friends at Health Exchange Resources or PwC or Deloitte or all the independent folks that are helping employers choose the right exchange platform. So noise is a good thing. All of this is going to make us stronger and better.
John, that's a great place to end this first segment. There's never enough time to talk with you because you've got a lot of great things to say, and we'll do this again real soon. And to our audience, John's going to stay with us, too, for the final segment, talk more about the exchange marketplace. But leave our audience with, a couple takeaways and thoughts from you, and then also let them know how they can get in touch with you. Okay.
There's a moment of truth research that Allegis did, and it basically points that unlike our experience in other areas of everyday life, the consumer experience in healthcare is frustrating. It's not consumer friendly, and consumer confidence is low. And I think we can solve this together. I'd like to see richer plan designs where people can win, incentives that pay employees for using high quality and fair price providers, people stepping up stepping up face to face to help people navigate, to help people get this, to help them understand the value of their HSA. And exchanges, I see them growing to know how to sell administration plus consumerism in tandem, making it a very clear C-suite choice. And I want to see anything producing greater literacy. And I don't think any of that is a fairy tale. And if you just give me just one quick second, I want to make a parallel of something that I just saw. I was watching this YouTube documentary on the making of Achtung Baby, which is my favorite album, and how they lost themselves with the prior rattle and hum fizzle, and they were creatively stuck. In fact, they were at risk of being a cliche. So they go to Berlin like 25 years ago, and through a lot of angst and near collapse of that band, they find a groove that eventually becomes the song One, and it ignites them to take their music in a new direction. And Bono said this: you have to reject one expression of the band before you get to the next expression. And in between, you have nothing. You have to risk it all. And I think that's where we are. We have to reject certain things for our next Consumerism 2.0. And people can get a hold of me at john.young@consumerdriven.com or text me at 612-490-2184. And I will do everything I can to make a better customer and consumer experience in healthcare, no matter the stakeholder.
John, thanks as always, my friend.